911, what's your emergency?
It's my daughter. She's lying on the floor. She's not moving. Help me, please. Hurry. I don't think she's breathing.
Can you tell me what happened?
She took some of my mother's pills.
Prescription drug abuse is Oklahoma's fastest growing drug problem. Many people are still not aware that the misuse or abuse of prescription drugs can be as dangerous as the use of illegal drugs, leading to addiction and even death. According to the Centers for Disease Control and Prevention, deaths involving opioid pain relievers have been climbing.
Whenever somebody starts taking prescription drugs for a non-medical reason, it no longer is a medicine, it becomes a drug.
A crucial first step in tackling the problem of prescription drug abuse is to raise awareness through the education of parents, youth, patients, and healthcare providers.
I've seen a girl come in, she was barely awake, pinpoint pupils, and I said, "What have you done?" And she said, "I was skittling." And I said, "What is skittling?" And she said, "Well, that's when you take a bunch of meds from different kinds, they're all different colors, and you just grab some and take them, like at a party," and that's what she had done. And it nearly died from it. But
some individuals who misuse prescription drugs, particularly teens, believe these substances are safer than illicit drugs because they are prescribed by a healthcare professional and dispensed by a pharmacist.
It's a parent's worst nightmare. May 19th, 2011 was the worst day of my life. Austin's death was caused by 2 pills that he took. Within those 2 pills, there were 5 different types of painkillers. You do not know what's in that pill that came from someone's medicine cabinet.
Many people who misuse painkillers obtain them from family and friends, either by giving or selling their prescription medication or taking the medication without permission. It's illegal for anyone without a license to dispense prescription medications, even for free, and is a Class E federal felony punishable by up to 5 years in prison.
We've had several arrests with people that are in possession of a controlled substance, meaning a prescription that is not prescribed to them. Anybody who's in possession of a Schedule 1 or a Schedule 2 or Schedule 3 prescription pain medication and does not have the valid prescription for that is actually in possession of a controlled substance.
when we see something come in that's not legal, or abuse of medication that was taken not like prescribed, but overdoing it, we call the police immediately.
It's a felony to take somebody else's prescription drugs or to share your prescription drugs.
There is also a small group of practitioners who abuse their prescribing privileges by prescribing these medications outside the usual course of professional practice. Some of these prescribers think they are being helpful.
We've had the problem of doctor hopping, doctor shopping, pharmacy hopping. That's been around for quite some time. It's becoming more prevalent with the increased rise in prescription drug abuse. So it's just something that's the state's now monitoring and taking action on by a online database that's used by the pharmacies and physicians. We notice that there's an issue or a possible problem going on with the patient. We contact the doctor's office, let them know that we've noticed a trend with the patient.
Research and medicine have provided a vast array of medications to cure disease, ease suffering and pain, improve the quality of life, and save lives. We must take urgent action to ensure the appropriate balance between the benefits these medications offer in improving lives and the risks they pose. The Oklahoma State Department of Health's Injury Prevention Service offers the following suggestions for preventing prescription drug overdose. Only take medications as prescribed and never take more than the recommended dosage, especially when taking opioid painkillers. Never share or sell your prescription drugs. Keep all pain medications in a safe place and locked up if possible to avoid theft and access to children. Keep medicines in their original bottles or containers. Never drink alcohol while taking medication. Put the poison control number on or near every telephone. It is imperative individuals properly dispose of their medications when they are no longer taking the medication to avoid possible abuse of prescription medications. To properly dispose medications, first, take your prescription drug out of their original containers. Mix the drugs with an undesirable substance such as coffee grinds or kitty litter, and mix in a container with a lid, such as an empty margarine tub or a sealable bag. Conceal or remove any personal information, including RX number, on the empty containers by covering with permanent marker or scratching it off. Put empty bottle in with drug mixture and place in trash can. Do not flush medication down the sink or toilet, as it causes the water systems to be contaminated. Or you can check with your city or county government's household trash and recycling service and ask about drug take-back programs in your community. And where there are drop-off sites operated through the Oklahoma Bureau of Narcotics Safe Trip for Scripts Drug Prevention Program. Additional suggestions to protect children are: avoid taking medicines in front of children, as they mimic adult behaviors. Do not call medicine candy. Do not let house guests leave drugs where children can find them. When taking medicines, do not put the next dose on the counter or table where children can reach them. Never leave children alone with household products or drugs. Other important tips: combining pain medications with other sedative drugs can increase the toxicity of pain medications. Avoid using pain medications as a sleep agent.
There's a need because Oklahoma is very high in non-medical prescription drug abuse and opioid deaths, and Garfield County is one of the top counties in the state of Oklahoma.
If you weren't prescribed it and you weren't given the specifics of how it's supposed to be used, you don't know, and it can result in death, as it did for Austin.
No matter where you are, you can help address this issue and reduce the risk of unintentional diversion or harm. And most importantly, talk to your kids.
We know our children so well that we forget to be really diligent. Watch for those little signs, because there are so many things in today's society. And once again, I think he thought, this is prescription. I'm good.
By following these practices, not only could you be saving the life of a loved one, but also your own, as well as the lives of future generations through appropriate disposal and storage of medications.
I hate for Austin's death, the way he died, to overshadow the remarkable young man he was.
For information, please contact PreventionWorkz, 580-234-1046.